Ah, yes, indeed. On Talk City 91.1 FM, Nicholas live with you on this good-looking, what is it? It's a Thursday afternoon, and I am really delighted to have this young lady in studio with us. She's no stranger to Talk City 91.1 FM. She is the gentle gynecologist, we call her. And she is Dr. Rachel Corridon. Good afternoon.
Good afternoon, Nico. Thanks for having me.
Oh, I like you're very official with that, Rachel. I like
Yes.
that. Good afternoon. Pleasure seeing you, my love. How
Yes.
are you? It's been a while.
I'm doing well.
Yeah.
Yes, it has been a while,
Yeah.
a couple months.
About,
Yes.
3 or 4
Yes,
months.
but I'm doing good.
Yeah.
Everything is well. And how are you?
I can't complain, a few scattered showers, but that's the way I like it.
Yes.
You
Keeps you on your toes.
Tell me up, oh girl, and I am on my toes, definitely. I am delighted to have you, as I said before. You speak to women's issues. Well, you speak to just about everything, but when it comes to women's issues, you are right on target. And one of the topics we wanted to do for, and I call it Mother's May, is do you know that we spoke about infertility?
Mm-hmm.
We
Yes,
did
we
before.
did before.
Because somebody called me and said, please, Nicole, we need to do infertility. And I said, we did that. So I guess maybe we can do it in further programs. But today we want to talk about aging and parents and women, in fact, and fertility.
Yeah.
As I said, in the promo, there are a lot of women that are striving to become pregnant later, and because they're saying, listen, this is my course. I want to make sure that I have all my eggs in my basket. I want to make sure that I do, like one person said, that she wants to do her master's, and she
Right.
says that is going a child right now, no, and she says she wants to give herself 5 years. You should see Rachel. Oh, you can see. I was just about to say you should see Rachel's face as I said 5 years. So she says that she believes she'll probably get pregnant around 40, 41.
Right.
And I said, but you know how they say it's difficult. She said, not in these days, Nicole. Where have you been? Listen to me. It's easier now to get pregnant. There's so much that you can do and so forth. So I said to myself, you know what? Let me bring the professional, someone that can dissect and put us right.
Yes.
Tell me, getting pregnant in your 40s, what does that say?
It's not impossible.
Okay.
It's not impossible. So we would say that. But there is the reality that more and more, as gynecologists, as doctors, we are seeing women, as you say, delay pregnancy. Many reasons we delay in pregnancy: for education. Sometimes it's harder to find a partner. I don't know if you miss that window in your in your late teens and your early 20s. It's like,
Yeah.
no ring,
Yeah.
that kind of thing.
Yeah.
That's what women are facing these days. So education, no partner, or just financially wise, a lot of women are not going to just get pregnant without having all their ducks in a row anymore. We are planning families more and more, and as doctors we advocate for planning families. But what does that mean? It means that as doctors we have to manage women who are now older. And what does older mean?
Rachel, do you have to stress on the older like that?
Yes, I mean, my personal story is that I had a baby in my 20s and then I had a baby at 39. So I understand.
Okay.
I understand.
Even though I don't think 39 is older.
Well,
Okay.
after 35, unfortunately, we class that woman as an older woman, so advanced in maternal age, if you get pregnant after the age of 35. And definitely if you are over 40, you are very advanced maternal age. And the reasons for those classifications is because we do know that there are certain things that one can affect you being able to get pregnant, and I will explain. And also during the pregnancy there are complications that can occur as well.
So there are complications, and there I was thinking about maybe 40, 42, but you were saying from 39.
From 35.
From 35. There still are challenges. And you know what? This is something that we heard about, but I don't know. You just think research now tells us, and you know what also tells us that it's easier to, Rachel, when you look at those online, those stars, quote unquote stars, and they're getting pregnant at 49, 50, and all that, and they look, not to mention, they look glamorous.
Yes.
So in our minds, in our little third world country, well, if they can do it, I can do it. But again, I might be contradicting myself, because in a way I'm saying, yes, we can. But there are also some limits, and there's certain things that needs to be done if you want to have a healthy pregnancy.
So as I started off, what I started off with is not impossible.
Okay.
But what you have to know is that, one, your chances of actually getting pregnant without help, so without some sort of fertility help, it decreases. Your chances of getting pregnant without that decreases as you go up in age, 35, 40, and definitely 45. That's almost how we break it up. And so a woman who is in her mid-20s is going to get pregnant by the time a year she's expected to be pregnant. If she's having unprotected intercourse, you're expected to get pregnant within a year. And so if you don't, and especially within 2 years, if you don't, we start to ask questions. But as you go up in age, that frequency of getting pregnant is going to become less and less. And the reason is because as we go up in age, our egg number and quality decreases. So we are not able to ovulate and give good eggs. And then when we do get pregnant, we have eggs that were of such low quality, we are at an increased risk of loss. So we call it miscarriage. So if you are getting pregnant over the age of 45 and upwards, your rate of loss is really, really high, almost 90%. You know, it's a really, really high rate of loss. So when we are counseling women, one of the things we have to do is let them know, okay, you want to delay pregnancy. One of the things you may want to consider, depending on the age that you want to start, might be egg collection, egg storage. That may be something you want to consider, depending on the age that you actually want to try.
Well, you're going to have to go into detail as to this egg storage, because again, this is something that you hear bantered about. Why don't just freeze your eggs?
Well, it's a process where when you have viable eggs, you would go to a fertility center, of which we have about 2 in Trinidad and Tobago. Right, so this is beyond the general gynecologist like myself. This is a specialized field, right? So you go to the fertility center. Of course, they will screen you and counsel you, explain to you, tell you the financial aspect of it as well. And then they would induce you to produce a certain number of, good eggs, and then they harvest it. What is harvest? Through the vagina, they will, let's say, suck or get the eggs from your ovary under ultrasound guidance, and then that is now prepared in a laboratory setting and stored, right? And so when you are ready, if you are ready, they then retrieve these eggs, right, and take it further. And you will go through a process of what we call in vitro fertilization, where they will now take your sperm, the male sperm, put it with your eggs, and we now try to get viable embryos. But this is a specialized field. It's not a field that I am directly involved in, but we have to know about it to talk to our patients.
Absolutely.
Yes.
Because when you hear about storing your eggs, you do not, for whatever reason, you don't think about those minute details that comes into it. And if it is that you are delaying your pregnancy, this is not a conversation you should be having in your 30s. I'm assuming you should be thinking about this earlier in your 20s, so that you have viable eggs.
You would have viable eggs. You would have in your 30s, up to even 35. We are okay for you to start to do your egg retrieval and stuff like that.
Okay, so storing of the eggs, you can do it in your 30s.
You can do it. Once we retrieve the eggs, they would test, they would make sure everything is okay, and they will store the best eggs.
I'm going to ask a silly question, but my teacher used to say no question is silly. But if you're saying that up to 35 we can store the eggs, and then on the other same
I am
token,
not saying that only up to 35. I am saying that may be the best period. But once you have viable eggs, they can be retrieved. Once when the
Okay.
when the fertility center induces you and all of that,
Okay.
once you have good eggs, they can be retrieved.
So they can retrieve the eggs at 35,
Mm-hmm.
but you have challenges getting pregnant.
Correct.
Hi, how now again?
You have challenges getting pregnant
Uh-huh.
upwards after the age
Okay.
of 35.
But your eggs are good, but you still would you
Your
have
from
challenges.
what we talk about is like a fall. So
Okay.
35
Mhm.
is like the peak time, the extent at which your fertility is at its best.
Mhm.
Best is actually within your 20s, right? But after 35, we then start to see the decline. That's what we're seeing. So we're not saying that it's impossible, but
Okay.
we start to see the decline in
Okay.
function, the decline in quality. And definitely 35 is one cutoff, but then we're talking about 41 and 46. Those are other cutoffs where we see like drastically. If you are trying, we may actually have to have you get an egg donor. And so you mentioned the celebrities who are 50, etc. They may not be getting pregnant with their own eggs. They are not going to tell you the whole story,
Yes.
right? So at 50, it is almost unlikely that you got pregnant with your own egg unless it was retrieved when you were younger.
Mhm.
Yeah, you have a much higher risk with your getting pregnant with your own eggs at those ages of things like issues with the genetic composition of the egg. So you have more risk of things like Down syndrome, what we call aneuploidies. So abnormal formation of the DNA, let's say, to put it simply, of the DNA of what's inside of these eggs,
Yeah.
right? So women going through in vitro fertilization at these extremes of age are likely having donors or using eggs from in their younger years. So that's why we have to discuss it with our women and send them on to the specialized centers to get more information, to get more in-depth counsel so that they can make informed decisions. Yeah.
This is so informative. I'm learning so much as is. What are some of the common misconceptions found around fertility and getting pregnant older?
Well, one of the things we must stress is that you want to be your most healthy self, right? So it's not just you have sex and you get pregnant. No. Once we want you to be mindful of what needs to be done with you personally before getting pregnant. So we want you to be on high dose folic acid, right? In fact, any woman of childbearing age or any woman not preventing pregnancy should be on folic acid, but and with certain medical conditions need to be on a high dose form, and your doctor would advise you on what high dose folic acid is. Why do we need to do that? So that the brain and the spinal cord of this new fetus is formed well, right? So our women of advanced ages over 35 are at a higher risk of these issues happening when the baby is formed. We want you to, after 35, heading into 40 and stuff like that, you also see personally your medical conditions starting to come up. So you're talking about your diabetes, your high blood pressure, your cardiovascular disease, so issues with heart and circulation and kidneys and stuff like that. These little issues start to creep in. So you need to be having your yearly doctor's checks to make sure that you're screened for these things, so that if you are about to try to get pregnant, you know that even if you have diabetes, it's controlled. The medications that you are on are not going to affect an early pregnancy. They're not going to affect how the baby is born. So those are the things that we need to, that is the main thing that we need to bust. It's not just have sex and get pregnant. You need to prepare for it, so that when you have this child, you're giving this pregnancy the best chance. Yeah.
I'm hearing the preparation with the eggs, and I think obviously that is crucial. That's important. But I'm not hearing anything about the sperm.
Well, both a man could get a woman pregnant at any time.
That's unfair.
It's unfair, but it's the truth.
Yeah.
Right? But even with the male, what we want to see in the male, now as he ages, there may be some issues with the formation of his sperm and stuff, but what we want to make sure in the male is that he has reduced his smoking or cut it out. Any illicit drug use, alcohol, we want to cut out all those things so that what you give to the woman is going to be healthy. Reduce your weight too, by all means. Get rid of your obesity, diabetes, control, watch what you eat, watch your medications and stuff like that. But in terms of the medical conditions, it's mostly the female, right? Because the medical conditions can worsen during the pregnancy or they can cause complications during the pregnancy. So that's why we want them to be controlled from before, especially in the woman. But for the man, we want you to be healthy. Give us good stuff.
Seeing that you can give us good stuff until the ripe old age
Yeah,
of 99,
correct.
100, and you're still good to go.
Correct.
Wow. Yeah. I want you to take us into the procedure now that, and I hope we're not straying topic, but we've gone in this direction. So she is pregnant. All right. And older and pregnant. Some of the precautions now, because, now the work begins.
Yeah. Right. So in the beginning, mommy is going to have to be told. Now, generally in the general population, about 1 in 4 to 5 women would have a loss. Right. So that's about 25% of women would have an early loss. So that's within like the first 13 weeks of first trimester miscarriage. But for our mummies that are quite older, that loss rate increases drastically with age. To the woman that is over 40, that loss rate can go up to even 50%. And when you are over 45, it can go up to even 80-70%. So you have to look out for loss.
See those loss ages.
So in general, in the general population, the loss rate is like 20 to 25%. So 1 in 4 to 1 in 5 women, unfortunately, would experience a loss in their pregnancy. And this is before the age that we consider viable, right? Viable meaning if the baby comes out of your tummy, at that point, that baby can survive, right? So loss before that is called a miscarriage. And so, especially in the first trimester, women will tend to lose their babies at a rate of 1 to 4, 1 in 5. But as you age, that loss rate increases. So we have to look out for it, right? We're talking about going up to 50 and even up to 80% as your, even 90% as your age goes up, right? The other thing we have, so that's in the early part of the pregnancy. So we break up, usually when we're talking about things in pregnancy, we talk about before, we talk about the trimesters, right? So in the beginning of the pregnancy, you're looking out for loss, you're looking to ensure that your woman is on correct medications, that she's on her folic acid, and that you have done your screenings, especially for diabetes. So you want to screen her for diabetes, make sure. Some women don't know that they're diabetic until they come to their antenatal booking, and we do the screening. So that's why it's so important to book early.
And how does that affect the pregnancy?
So diabetes in pregnancy is a whole vast topic by itself, but in a nutshell, miscarriage again in the early parts of the pregnancy, worsening eye and kidney health if the patient has very bad diabetes. And also as the pregnancy progresses, when we're going into like your 3rd trimester and stuff, well, also the pregnancy, increased risk of infections like urinary tract infection, an infection that a normal woman would just clear with simple antibiotics. A diabetic woman could get very, very sick, and we call that sepsis, right? And as you go along in the pregnancy, that diabetic mom, the baby now is at an increased risk of being big. So we call it we call it a macrosomic baby, or our little sumo wrestlers, right? They're very, very big and fat
Really?
and plump. And
would that mean that you have to have a cesarean?
correct. So
Yeah.
if the baby is more than a certain weight, then we cannot allow for a vaginal birth, because that in itself would have complications, like the baby being stuck in the passage as mommy is pushing and stuff like that, which is a traumatic and very serious emergency. Right? You're talking about baby being cut off from its oxygen supply, and even damages to the mommy's perineal area, etc. So that's very serious. So control during the pregnancy with regards to diabetes helps us to manage that big baby issue. You also have the issue of baby suddenly passing away inside of mommy's womb, which is called an intrauterine demise, or what's a stillbirth. So you have mommies coming in at 36 and 37 weeks, and they've just simply stopped feeling the baby move. And it is very prevalent in women who are diabetic, and also in women who have advanced ages.
Yeah.
So stillbirth is a very, very pressing issue. And so in the women who don't even have any issue like diabetes or high blood pressure or anything, they're just older, so the advanced ages, we tend even to sometimes offer delivery around the week 39 or so, just to ensure that we give you a live baby in your hand without that dreaded complication of stillbirth. Yeah. So that was diabetes by itself, but you also
I
have
quite
other
understand,
things.
and I'm
Yes.
glad you said that. That's a whole show. by
Correct.
itself, because I'm pretty sure there are lots of other
Yes.
details that you wanted to give
Sure.
on that. But
And because even after the baby, every diabetic mom will have issues with its own sugars, like the first few days of life. Sometimes the babies have to be on sugar drip and all of these things. So that's the diabetic mom. But we have other issues, especially like high blood pressure issues of pregnancy. They are more prevalent in the extremes of age. So the very, very young teenage mom and the older mom. And these high blood pressure disorders can go into what we call preeclampsia. This is where with the high blood pressure, mommy is now spilling protein into her urine. She has symptoms like headaches and seeing funny, seeing blurry, spotty, flashes of light, seizures, right? We call that eclampsia. It can affect the baby's growth. Being of an older age affects the baby's growth. So you have mommies of older ages having their babies born a bit smaller, which actually happened to me, right? So my daughter was small for gestational age. And so you just have to, the purpose of your doctor, of your obstetrician, is just to guide you through. It's not to make you scared, but it's to inform you. It's like an information gathering process. So I'm pregnant, what should I expect? You know, it's not always just going to be happy-go-lucky and everything is fine, which could very well happen. But what we have to do is look out. Any obstetrician with their waiting goal is going to be able to quickly pick out an issue like this and be able to deal with it properly, right? So small babies, which is growth restriction, issues with diabetes, issues with stillbirth, issues with high blood pressure problems, a higher rate of cesarean section also in the women who are of older ages. And so these are some of the things that we encounter as doctors when dealing with women who are older.
And some of the good news.
Some of the good news, it is the most beautiful thing to see a woman who has either tried for a very long time and
she
is
has
now
a bundle of
42
joy.
or 43, and she now has this precious little one. That child is ours too. So faith, go with God. It's not doom and gloom. We are looking out for the issues, but we also know that our aim is a healthy pregnancy, to have success, to have a healthy mom and a healthy baby, and we hold your hand through and guide you through it. So as I tell women, I am not the lock and key to your uterus, right? If you want to do it, okay.
Yes.
But I'm going to tell you what to expect.
And
And
how
if
it
you
is
need
done.
help,
Mhm.
I'm going to refer you on to people who can help you.
Yeah.
Yeah? So if you are trying to get pregnant over 35 or 40 and it hasn't happened in the last 6 months, please don't wait anymore. Let's have a conversation and let's put you on to the fertility doctors because you need help before time runs out. Yeah, so don't just stay there year after year, you waiting, you wait. Yes, there is faith, right? But there's also expertise on the earth that you can access.
Absolutely, and God would have
Yeah?
gifted
Correct.
those people like your good self, the professionals,
Yes.
with the expertise.
Mm-hmm.
you know?
Yes. So once you are over 35, you're 40,
Mhm.
and you've been having this issue, or you most recently you got married, one of the things you can do is just have general checkups before you start the process, right? So you're going to get married, you and your partner go in, you do your STI, which is your sexually transmitted infection. You do those screenings, you just have a regular pap, you do your uterine ultrasound, your pelvic ultrasound, just generally make sure everything is okay. You don't have to go in specific testing and stuff like that. But after 6 months, if you're having regular, it has to be regular. You have to actually have sex to have a baby. So once you're having regular intercourse, which is at least 3 times a week, right? If you're able to achieve that and you're not conceiving after 6 months, then come in and talk to your doctor.
We've seen, Rachel, where it's actually timed, because there's a time where the woman ovulates, and
Yes.
you see them speeding to make sure this thing happens.
Like in the movies,
Yes.
yes. So we call it your ovulation window.
Yeah.
And that ovulation window generally falls smack in the middle of your period. And one of the things that you can do on your own to track your period, one is use a pregnancy app just to mark your days. That's one of the first easiest things you can do. And after a few months, the app is going to calculate for you your fertility window. And every month it's going to tell you when it's the best time. And you focus your intercourse then. But another thing you can do simply at home is pee on a stick. An ovulation strip, you can get them in pharmacies, but of course speak with your doctor first. Make sure there's nothing else going on that is preventing you from getting pregnant. But that's one of the things that you can do, and it will tell you when you're ovulating.
Yeah. Rachel, we are just out of time, and this conversation really
I
has
can't
been
believe we're out of
enlightening.
time already.
Yes, I know, but that's why you have to come back, and I know you have a very busy schedule, so I'm so happy when I'm able to get you. There will be people watching and listening and saying, I want to talk to this doctor. I love her demeanor. I love her bedside manner, as it were, which is not to take anything away from the other doctors. We're not saying,
Yes.
specialties. But, yeah, they want to connect with you. How can they?
Well, definitely you can WhatsApp or call at 494-6669. And you can check me on my website. You can send an email through there, and the website is yourgentlegynecologist.com. So those are you can check me on Facebook, Your Gentle Gynecologist, Facebook, Instagram, and TikTok. Sometimes YouTube as well. Yes, you can find me anywhere, right? Just
You
connect
can
with
find-
me.
Great.
Yes.
You can find Gentle Gynecologist just about anywhere. YouTube sometimes, TikTok,
Facebook,
and
Instagram. Yes.
And you also give some nice little antidotes, I find, when
Yes.
I watch on your page. So, looking forward to having you at a time convenient one more time.
Definitely.
You know, I